Hi, my name is Victoria Goldberg, and I'm a first-year medical student at University of California, San Diego. Thank you so much for participating in the Wellness Wave brought to you by ACP Southern California Region 3 chapter, and I'm representing this chapter. Today, I'm honored to interview Dr. Charlie Goldberg, the Associate Dean of Graduate Medical Education at UC San Diego and Clinical Professor of the Division of Hospital Medicine at the VA San Diego. Dr. Goldberg, would you be so kind as to tell me a little bit about yourself?
Sure. Hi, everyone, and thanks for having me. I was born and raised in suburban New York on Long Island. I went to public high school. My dad was a physician and my mom ran his office, so I sort of had more than a little bit of an inkling about what it was like to be a solo practitioner back in the day. I went to college in Amherst College in Massachusetts, a small liberal arts school. And from there, I went to the University of Vermont College of Medicine, which was, they were both wonderful experiences, both very small school. My med school was 93 students, very clinically oriented. I met my wife the very first day of medical school. I didn't know she was going to be my wife then, but Teddy Nelson, who is a pediatrician and actually is now a developmental behavioral pediatrician and has her own very interesting life arc. She works at UCSD, if you're lucky enough to meet up with her. And she did a fellowship at the age of 50. So you can really be a lifelong learner. So it was wonderful, it was very well received. I got to develop tools and websites that help people teach and learn. I got to create courses. And then when the current curriculum got launched, which was around 2010 or 11, I got to be part of that process of what does it look like to build a curriculum from nothing, to just wipe it out and create what's ideal in this moment, and to use all of my own experiential learning and then the learning from the literature of, active learning, small group learning, minimizing lecture, clinical relevance, et cetera. It was great. We could build all those things. And I love that opportunity, and I love my colleagues. So the faculty, the staff around here are great, relentlessly great. And the students here are and were always great as well. We're blessed to be in Southern California, and in California in general. There are a lot of bright, motivated people who want to do good in the world, and that's really important. So that's how I developed my career trajectory, was then building courses, being a course director, being an academic community director. In the residency world, I was an associate program director in internal medicine for about 6 years. And so I was growing and shaping. I learned what I could do individually and teach, which was great. I was constantly learning about patients and patient care. When I came here, I worked in an ER. I worked as a hospitalist, so they didn't call it that. And I had a clinic, and I supervised residents and students in all those spaces. And I loved it. And as I moved along, I sort of sharpened things, and I became more, in addition to taking care of patients, focused on, can I create structures where others can use the things, the tools, the curricula that I create to teach without me there. And that has become interesting to me, and trying to create systems that allow for the best possible approaches to learning have become a focus, and building out leadership opportunities in that area. As I mentioned, my wife, who is wonderful and a fabulous partner, and we've had a lot of constant conversation about, where is your career going? Where is my career going? How do we share this? Who's looking after the kids? We have two wonderful boys, Aaron, who's 18 and is just starting this week his second semester as a freshman at Wesleyan University in Connecticut. He loves it. He's in person, which is great. He spent a lot of time in COVID high school, which was just challenging. And Max, who's 17, another fabulous kid, he's a junior in high school. So this constant management, which is, again, it does link to wellness, because these are the core parts of what I love and what I love to do and the people that I love. And everything needs to be attended to. A big thing that I've learned, and I constantly relearn, this you're never like good to go in any of this stuff, is that intentionality is really important. If you just assume wellness is something that it sits in its own box and you'll just attend to it at some point, as opposed to a core aspect of who you are that you need to think about every day, I feel you're not going to be very successful, and you're probably going to be less well than you would be otherwise. And again, this is all, I have to say, informed opinion, right? This is my experience and what I've seen in my personal journey and being fairly observant of what goes on amongst others. So if you think of wellness, like wellness activities, which are nothing wrong with mindfulness, they're great tools, right? Yoga is a great tool. Being outside is a great tool. But if it's stuck on like a term of the moment, like a spike protein on a COVID virus, that doesn't work that well. As an add-on thing, it needs to be interwoven. It's got to be part of your daily DNA. And it needs to be attended to. And so when I think about wellness and I think about advice and things to do, it's that intentionality, it's to own it. It's to think about what are the things that will make me feel good, make me feel better, elevate my day-to-day that I need to do every day. And so sometimes that's, could be going to the gym for 15 minutes, 20 minutes. When you think about it as something that you'll attend to at a later point in your career, because, well, I'm an intern. So, geez, finding the time to do those things, I'll do it next year. But then you're a resident, and you're a second-year resident, third-year resident, and then you're a junior attending, or you're a fellow, and life just keeps happening, and the complexities and the demands of life, they continue. They're just different demands. So you need to think about what are those other aspects that are important and build them in so that I have found they're a continual presence in my life. The other things that are important is, you went into medicine, into healthcare for a reason, right? You wrote a personal statement that this is your purpose. This is what's important to you. And it often, I think everyone has written very similar things. Their path to it is different. We're all individuals, but I want to do something that has meaning. I want to help others. I want to work together. I want to puzzle through problems. I want to have an impact. I want to feel good about myself. All those things are still relevant. The authenticity of those statements stay the same. And so if you don't attend to that every day and think about it in an intentional way, it can get lost. It's very easy for your journey to get hijacked by whatever, the system. The system isn't evil. It's a world of agendas, and often what's trying to get accomplished at bigger and bigger levels doesn't always line up exactly with what you're trying to do. And what your hope is, you want to do what you love to do and keep that aligned in some way so it fits in with the systems of healthcare so that you can function and work in an environment, get paid for it, etc. But in order to do that, you can't just leave it alone and think that it will look after itself. It is actually an activity that requires attention, and you need to think about it. And you also have to be brave enough, I think, to reconsider your goals. So if those are the acute things that you want to accomplish right now in your life and they make you feel good, great. You want to keep that as prominent as possible. And then you may evolve. And that's not bad. You may say, you know what, this is great. I now am more interested in population health, or I'm more interested in the business of medicine, or I'm more interested in learning stuff and reaching out across my system, my school, my campus, and connecting with others to build other things. That's great. Think about it. And then you may have to give up some stuff to get some other stuff. But that's the ownership process, because it gets back to what makes you happy. What's your core? What's your North Star? And how do you keep that North Star a prominent feature and focus, allowing it to evolve in some way? And it reinforces the notion that you are not a leaf in the wind, that you have agency. It is very easy to say, God, I'm just like a drop in the water here. What impact am I having? You are having an impact. And you do have a lot of control, more control than you think. But you have to stop and own that control and say, what are the decisions that I can make in this moment that are going to allow me to align my goals with my environment? How do I attend to that? And if you can do that, that is a way of continuing to feel good about what you're doing and what you're accomplishing. I think it is important to stay connected. We've learned many things from COVID, but the isolation is just dreadful. The isolation from each other, from the support we give, from other healthcare workers, from the interactions with patients. Telehealth is wonderful. I get it. You can connect that way. And that is a type of connection, and it is totally appropriate in the right moments. It shouldn't be the only connection. I mean, I like literally being at the bedside with a patient to talk and see when that's possible. And to help and to reach out and to lay hands on, maybe through PPE and gloves these days, but to be there as a presence, to be sick and to be alone and to have the healthcare system afraid to come interact with you, that's a dreadful experience. That's got to be really, really scary. It's scary for the patient, and it's not satisfying as a clinician. So maintaining these periods, these important connections, and regrowing them and develop them as quickly as possible, as is safe, as COVID regresses for now, is vital.
Absolutely. Thank you so much for your wisdom, Dr. Goldberg. And I wanted to ask, do you have a wellness phrase that encompasses what wellness means to you?
Yeah, how about this one? Stay true to your purpose, seek out and grow your connections to others, and be kind to yourself.
I'm very grateful that you took the time with us today and time with me today, Dr. Goldberg, to share your insight and your experiences and your incredible journey, and really accepting that it's okay to just introspect sometimes and look deep into yourself and figure out what makes you happy and what makes this practice of clinical medicine fulfilling and joyful, and really focusing on those moments of joy in medicine. I think that's really incredible advice, and really will resonate with a lot of trainees.
I hope so. I mean, I wouldn't say not just can, should, like it should be just part of what you do. It can't be every second, but how did I get here? What am I doing? Where am I going? What am I trying to accomplish? And those are vital, because otherwise I fear people end up just 20 years down the road doing something, and they're wondering, like, what happened? How did I get here? It's through a series of steps, and we live in rarefied air in medicine. A lot of great opportunities educationally and otherwise, and they're usually the results of, because I did this and then this and then this, and here I am. And is that a good here? Or is that not a good here? That we really need to have an awareness of. And truly being grateful of having an environment that is surrounded by a lot of like-minded people in terms of those who want to do good in the world, right? That we all started out this way. It's not perfect, I get that. But when I look around, it's more like that than not. And people are here on a common journey. And that's a wonderful thing to have as a foundation. It's great to have an opportunity to speak like this. And if there are any students or residents or whoever it is that's going to see this video, I'm available. My email is cggoldberg@health.ucsd.edu.
Thank you so much, Dr. Goldberg, for meeting with me today. We greatly appreciate your participation in the ACP Wellness Wave, and we look forward to staying in touch with you soon.
Absolutely. Stay well, Victoria. I look forward to seeing you in real life.